استوديو نور الممزر.
أهلا. النهارده معانا حلقة ابتسام. حلقة ابتسام حالة لطيفة جدا، من أسهل الحلقات اللي عملناها. كانت أحلامها بسيطة، بالنسبة لها كانت معقدة بس بالنسبة لنا كانت بسيطة. حاولنا نديها الشيب اللي بتحلم بيه. ابتسام من أروع الحالات اللي طلعت، ازاي جسمها تحول تماما من شكل ملوش أي ملامح لشكل بيرفكت كل الناس بتلف راسها لما تبص عليها. ابتسام كان نفسها تبقى موديل وبقت موديل. يلا نشوف عملنا معاها ايه.
اسمي ابتسام، عمري 26 سنة، من المغرب. أنا صار لي 3 سنوات بدولة الإمارات، اشتغلت في العقارات واشتغلت في مجال الموديل. سمعت على برنامج ستوديو نور الممزر عن طريق السوشيال ميديا. المشكلة اللي بعاني منها أنه عندي صدر صغير وعندي خفافات وعندي بطن ودهون في ظهري.
Larry, concentrate with me. Okay?
Focus.
Yeah, I'm trying to tell them that you are a professor. Okay.
Good.
Okay. So, why Ebtisam was a perfect case for Dr. Larry? Because I know you are very good at liposuction. She is petite, she is small. I know you love small bodies. Okay. And her case, like, she doesn't feel she is a female in the body shape. Okay. She is a pencil shape.
Okay.
Yeah, she's a pencil shape a little bit. Okay. She wants small waist, full transformation, 3D here, moving here, and injecting, removing fat and transfer to butt. Okay. The case that me and her is like, we don't know what is perfect, what's not. She feel like she has small breast. I feel she is perfect. Like the breast is suitable for her size. And she said like, okay, if it's a little more. So the situation is you now, we'll see. Inject fat or do a transplant, implant. Okay. Yeah. What is good and what is not good, this will be your, okay? So we need your honest opinion. Yeah. What will be perfect to Ebtisam, and will she achieve her dream? Because here we are achieving dreams for the case. Good. Will she achieve her dream like she have a small waist and big butt? She doesn't want to be big, she want to, like her Ebtisam is very beautiful and she has this body. Okay, خلاص, okay. But will she have this shape of Coca-Cola shape, mermaid shape?
It would be useful to see her.
We will see her
before, not with them.
She is okay to shoot. We signed everything, okay? We'll shoot, we'll say everything,
Good.
Okay? Just come see Ebtisam.
So essentially, you can increase the size of the breast with fat transfer about 1 cup. So let's say now you are, I don't know what, C or B. You can go from B to C. 250 milliliters, something
أنا
like
بناقش
that.
فكرة إن أنا وأنتي مختلفين على تكبير الثدي، فلازم يقول لنا رأيه الطبي الحقيقي في تكبير الثدي. ما هنشوف كل حاجة دلوقتي، بس يقول لنا رأيه الطبي الحقيقي. هل لو حقنا بس دهون من اللي هنشفطها يبقى بيرفكت وخلاص بدل ما نركب لك سيليكون ولا لا؟
يعني الصدر؟
نحقن شوية دهون في الصدر. وهنشوف ده بعد لما يشوف دلوقتي. We are aiming for a very good result. We are aiming for the perfect. She is living the dream now. So
what she has, she's got a little bit of the retrognathia. So I could also put a tiny bit of fat there.
Okay.
Instead of
بدل ما تحطي فيلر كل 3-4 شهور يحط لك شويه من الدهون اللي اشفطها هنا يحطها هنا سنه صغيره مش هيطول بيها قوي.
Forward, not downwards, but okay.
هو بدأ قصده انه بدل عارفه ما تحطي ملي فيلر فيبقى حطها في حسابها هناك عندك. بعد كده عاوزتي تحددي عليها الفيلر بتدينا نتائج احسن.
بيجي هنا تحديد صح؟
هو لازم اما يشفط هيحدد. خلفتي قبل كده؟ لا no.
No, the thing is, what is her intra-abdominal fat? What is her?
But a little bit. She has a little bit everywhere. This is a problem. So we'll have to be accurate. Even here, the bra rolls. Here, over here. Do you see?
That's good because she seems to be quite small. So if you have a little bit, we'll clean that and we use a little bit of fat to cover this and
she
a little bit to put there. So if
and
you
here,
saw her...
Here a little bit, but just we need her to be transformed. Like this body is perfect, but like, okay, but there is something missing. This something missing is our touch, okay? We need to be accurate, we need to be like...
Yeah.
Okay. We need...
What you were saying, breast for her size is definitely
right?
enough. Yeah, I don't have a meter with me, but
okay, bring the meter, please.
If you have a, but definitely if this could go inside a little bit, I'll just bother you like this.
But she has also a wide chest, not a lot of fat.
Yeah.
We will have to take a little bit from everywhere and put whatever, like we're reshaping the perfect body. Okay. Okay. Hello, Dr. Larry.
Hello, Dr. Hala.
Welcome to the studio.
Nice to be here.
You remember when I told you there is a big show and I want you to make your best with Ebtisam?
I hope I did.
I did. Okay. My main problem was this case that I'll have to speak in Arabic with Dr. Maya and English with you. And Ebtisam, when she came, she doesn't understand our English and she won't speak to you in French. So you will translate my French, I'll translate her Arabic, and we will do this, okay?
No problem.
Okay. So starting with, first thing first, when Ebtisam came first, okay, her main problem was her breast, okay? I didn't see there is a problem in the breast, but we'll take Dr. Maya's opinion, okay? Dr. Maya, hi. I'll take your opinion on this. And you are free to speak in Arabic, English, whatever you are free to speak. عايزاك تقولي لي رأيك في الصدر ده، اوكي؟ تجميليا، هل كنا محتاجين نكبره ولا لا؟ أنا هوريكي هاي ابتسام، اوكي؟ وهوريكي بروفايل تاني لابتسام. هذا. انت ما شفتي ابتسام بعد ما خلصنا عمليات فشفتي بني ادم اخر مش
كان بدي اشوف
she only saw ابتسام after surgeries okay so for her ابتسام is the model she is doing now okay and this is her from front view انت رايك تجميليا او لو بنت شفتيها كده تقولها حبيبي كبري صدرك
انا كامراه يعني بدون ما اكون هلا لا كسيرجن او طبيبه او شيء
ليه
هلا هي كحجم نورمال ما انه بنعتبر انه مثلا كتير في صغير او ما انه متناسق مع جسمها بس ليعطيها شوي معالم انوثيه اكثر يعني انثويه.
Okay, my main problem was Ebtisam that she has very wide chest and very small breast, and the chest was wide according to her to her hips and to waist. Okay, this unproportionate body or unproportionate sizes. My main problem is no. We don't have to inject to put silicone for a woman like she is young. She doesn't want to put silicone. Okay. She doesn't need to put silicone. She wants it. She wants silicone, but she doesn't need. Does she need as we have?
لا. يعني بس هيك lifting إعطاء شكل أضبط. بس مو إنه هذا الحجم يعني ما راح يتناسق حتى مع جسمه. الحجم الواو بس إنه.
Okay, coming to you. This is your work. Defend your work. Tell me. Tell me.
بس مصدومة
what is your opinion? بالبادي.
مصدومة.
لا هي اتغيرت تماما. The big change. You remember Ebtisam or no?
Yes, I do.
You remember this?
Yes.
Really?
Yeah.
Definitely. Bad position, but yes.
Remember this?
Yes.
Oh. Okay. Why would you put silicone to someone like Ebtisam? Why?
Not necessarily because she needs it. I don't like the idea of she needs it, but she can benefit of an enlargement. She can benefit of an enlargement of the breast, and she can benefit of a liposuction because the whole idea is that she's really like a square. It's it doesn't have any defining points. So
okay, but why silicone?
It depends, silicone, it depends essentially of the amount of volume you need to transfer. So I would have offered her very gladly. Point of view,
my main problem with plastic surgery is that why just add a little bit of fat and leave her like this? Because with her breast wasn't that small.
I would have perfectly offered her to do a little bit of fat, but that usually represents one extra cup. So let's say from her B, you go to C, but she wanted to have more than that. So as far as I'm concerned,
whatever the patient wants,
it's not my decision to tell her you need to do that.
But patient like Ebtisam doesn't imagine her body after. You have the responsibility to tell her how body will be.
That's where you get those sizers and you offer, or you can have a computer changed image, but you can offer them an image of more or less what happens there. I'm very happy with the sizers.
How many breast surgeries have you done? Breast augmentation?
I don't know.
I know
500.
with me 100 at least.
Yeah, 500 all I know. But those sizers allowed me to put on somebody 120 milliliters, and she was excessively happy with that, and to put on somebody 500 milliliters, and she was happy with that. It's a question of how the patient sees herself, her perfect image.
How many times the patient came to you and told you, "But for me, big size," and no, I'm not gonna put it. I know your way that you will only not gonna put it if it will harm the patient, as if it will stretch the skin too much.
If it's technically impossible, if there are a few ifs there.
Yeah.
But luckily, implants can be modulated, can be arranged so that they fit the desire of the patient. It's somebody who comes and says, I want 800 milliliters, I want not to wear a bra anymore in my life, and so on. It's, of course, you need to tailor the expectation. You need to bring to normal what they have in their imagination, and it's perhaps not correct medically or surgically or whatever. But I still think that the patient should be given the right to decide, this is what I like. And
if what she likes doesn't come with your experience. You have installed like 500 implants. I know it's more than this because with me you have already done like 100 or more. So you have done more, and I know that I know you don't push the patient to do whatever is right. Why?
There are things, and that honestly I believe the patient should be the one choosing the size, and I will choose the mode. I will choose the way, the placement of the implant, and so on. So implants can be put behind the muscle, behind the gland only. So there are many ways to modulate the wish so that you get a natural result, something that
Let's
fits
ask
the patient.
Dr. May as a girl, okay? As a woman, Dr. May, have you ever considered that no one tells us the harmness of whatever we are doing to our body? Like if I am putting an implant, there is a risk of cancer or no? What do you think? There is a risk of cancer with implants?
Scientifically, it has
Like a doctor,
not been,
yeah.
Scientifically, it has not been demonstrated. There are some type of lymphomas which are cancers that have been linked to the previous type implants. Now, yes, this is a thing that we describe to the patient, and we warn them, listen, this should be done and this should be done, and you should be aware of this complication and that complication. So in that point, sure, I would prefer to put her own fat.
And you tell the patient everything. You tell the patient whatever complication.
Most of the time, yes.
What is the biggest complication that can happen with breast implant?
Biggest or the worst?
Worst and biggest, like the most common and the worst. Worst, we all know it's cancer and it is very rare.
It's very rare. I don't know what 200 cases described, but still, that's the case. The most common complication is the capsular contracture. So the body will somehow be upset with the fact that there's a foreign body and reacts to it.
How the decision of the surgeon interfered with this capsulation?
It doesn't.
No, it does.
The technique might.
The technique and the decision of the size, because you left some girl to decide she will put 800 and her body refused to have 800.
I do not think that the capsular contracture has something to do with the size of the implant of a particular patient. It will have something to do with the type of implant, the type of surface, and the technique for sure, and how the implant is surfaced. The soft, smooth implant will not have the same problems as depending where it is placed.
التغيير راح يأثر بشكل كبير جدا، بيساعدني كموديل، بيفتح لي أبواب ثانية تاع الشغل، وما راح يسوي لي إحراج على حسب البحر، لأن لما بروح البحر بيكون في كتير إحراج. أوكي، ولما بسوي مثلا إعلان أو إشي بيكون صدري صغير، أو ألبس إشي مثلا هيك ستريت بيبينوا عيوب صراحة. لهيك بدي أسوي إن شاء الله العملية.
So let's exaggerate with the fat you will have that.
مع الدهون هيبقى ده الشكل. أوكي تقريبا يعني إنه الدهون بتعمل الشكل الطبيعي ده اللي هو الناتشرال شيب. طبعا مش هيبقى نازل كده بس، ولكن أيوة أنت بس شوفي القبال اللي قدام.
And I can put them here, so more volume up.
بصي
so it makes nicer.
بس هو هيعمل
and
هنا.
it's your tissue. That's the.
أيوة هيبقى she wants the cleavage. What will give her a best cleavage?
The implant.
ما ده اللي قصدي عليه، إن الدهون مش هتديك الكليفج. ده السيليكون.
The implant makes like Madonna thing, you know, it's there and it's very strong. That's where the pain comes from, but
بس انت هتستحملي الالم بتاع السيليكون بعد اللي تحت العضله ده، بقى مميزاته كتير. بيوجع اول اسبوع، هنديكي مسكنات ما عليكي من الالم، يعني هقعد اطبطب عليكي. بس انا بتكلم على اهم حاجه عندي النتيجه، يعني احنا بنعدي بالم مش ممكن، يعني الشفط والحاجات دي مش هتحسي بيها، بس السيليكون بالذات انت لازم السيليكون مش الدهون. سيليكون. Okay.
You can have it a little bit bigger if you wish, because silicone is not limiting. So this is 300. That's 200. That's a little bit bigger.
بصي ما تتخيليش كأنك حاطاه زي البرا، ها، وهيبقى تحتك، هو زي صدرك لقدام، وبس بيوريكي حجم الارتفاع. ده 300، عشان كده كان الدكتور بيقول لك 350. ده 200.
300. And then you have to imagine.
متهيألي ده.
Then you have to imagine that this one goes inside, and this one need to be about the same.
بس أنا هقول لك حاجة، أنا برضه هعمل معاكي الصح. هو قصده إيه؟ إنه ما ينفعش تبقي صدرك كبير من فوق وده مش مقاسه، لازم تبقي من هنا ومن هنا نفس المقاس، وهنا رفيع. ايوه، فهنا كده هيروح، بس على قد ما هيكبر هنا يكبر الصدر، فانا هاخد له معاه السيليكون، هاخد له 3 مقاسات، يقيس ويشوف ايه الشكل ويحط. اوكي، I'll give you 2-3 measures in the operation. Okay, you decide. She likes it like this. She wants perky.
300 is fine.
Okay. 300. ده 300.
Yeah. Over 12 centimeters. Fine, no issues. Yeah. No, I mean, we can put this in your breast without any problems.
بيقيس عرض صدرك، عشان عرض صدرك بيقسمه على 2 سيليكون، فبيشوف عرض السيليكون ايه اللي هيناسب. بس اوكي.
صراحة عايزة أقول إنه شكراً كثير على حسن ضيافتكم وعلى اهتمامكم، وكل الدكاترة ما شاء الله عليهم، يعني أعطوني وقت كبير جداً وحاولوا يساعدوني في المشاكل اللي عندي في جسمي، وبقول لهم شكراً كثير.
اوكي.
The pure of the implant.
Yeah. So how it's pure, how it's smooth, how it's everything. Dr. Mai, would you prefer to put a strange body in your body? Strange object?
For me, like a girl. Yeah.
Silicone?
Yeah.
And it's okay with you?
If I need, yeah.
If you need, no, this is the main problem. That
I think, yeah.
She said,
like
if
a girl.
I need.
If I need.
She will decide if she needs.
She will decide.
My decision. My decision is to tell her this is not possible technically.
Just technically.
Her decision is to say, listen, I don't feel a woman in my body, and I would like my breast to be bigger. And it does change. It changes amazingly how the girls feel about themselves, the way they behave, the way they dress, the way they hold themselves. Look at Ebtisam, she's like this.
Yes.
Yeah. And suddenly now she has a whole other attitude. So this is psychological intervention.
Have you ever done a surgery and you know that the outcome won't be good?
No.
You never.
No. I had some complications. I had some trouble.
Yeah, you didn't.
But I didn't do it knowing perfectly that it's a stupid thing to do. No.
Stupid thing to do. This is Dr. Larry's word. Always. When I told him, why wouldn't do this? This is a stupid thing to do. No, don't do stupid things. This is his way. Okay.
I will feel responsible for that patient. So I refuse myself to do something that I perfectly know it will go wrong.
Okay, what is right and what's wrong regarding chest size and breast size? Yani if I'm very wide from here to here, okay, and I told you, just put for me, I need only from B to C. B to C, just give me a little bit of augmentation. And you know, she has a very wide chest. Her proper measurements have to be D for a wide chest, wide hips. Would you interfere in this or no?
No.
Even there?
Yes, I will let
even
her.
Even aesthetically, like
that's what I was telling you. Somebody who has the opinion in her eyes that my chest, my body should look like this, I will follow that. And I put 120 milliliter implants, which seems like an unbelievable risk to put foreign body in a young lady because she wants 120 milliliter more, but she didn't have any fat. So we did put implant, and she was perfectly happy with that 120. And I put 700 implants on another girl who was tall and very wide, and
but if she is very tall and very wide, and no, doctor, just give me small things, because Google tells girls to do a lot of things that is not right.
That's where the sizers come into place, and you will let them come with a covering top, something that's very close to the body, and they will decide by themselves.
But you won't do the surgery if she is very tall and very wide, and she decides to put 200.
I will.
You will do it,
yes.
Even if aesthetically it will be wrong.
No, I do not take the liberty of judging the aesthetic of the thing. I will take the liberty of judging the aesthetic of a tummy tuck or of a facelift, but not of a breast.
Augmentation specifically.
Not of a breast.
Why? What is different? I want you to lift me like this, Dr. Larry. Please, Habibi, this way is bad. You will have whatever. This is a trend and it will be gone. Lifting is like this.
The trend should not be followed. The trend is not what you have in your heart or in your mind. And I don't think I should interfere there.
This is a big problem because your expertise,
not a problem.
Your experience is the most important thing. Why I come to Dr. Larry, not a young guy who is like 40 or 35. I'm coming to Dr. Larry because of his experience. Your experience matters because you have seen 500 cases, and these 500 cases give you a lot of outcomes, a lot of things that you have seen, what is good and what's not, even from the eyes of your patients, not your eyes.
If you hesitate between 200 and 250, I will encourage you to go to 150. But if you hesitate between 150 and 600, I will say, okay, you want 600, 600. You want 120, 120 will be.
This is my main problem in plastic surgery.
It might be a question of mindset, because I do not want to tell somebody.
You don't want to hold the responsible, or you don't want to say the right thing.
No. I don't want to tell somebody you need to do this surgery. Thank God we are doing plastic surgery, so it's a psychological intervention. It does not correct anything. So it is not somebody who has a scar on the hand or on the face and needs the scar corrected. You need the scar corrected if it's ugly, if it's really... a small breast is beautiful for some, ugly for some. So I do not want to make a judge and separate the world into too small breasts, too ugly, too big breasts, perfectly well. No, I don't think it's right.
Dr. Larry, thank you. Thank you.
Most welcome.
Thank you that you are the only surgeon I have ever met that really, really in his heart respect what the woman wants. Thank you that you always put your way or eyes or whatever, your respect of what's right, very in a distance from what patients want, what he loved to look in the mirror, what he loved his body, what he would like to see himself. Okay, thank you. The voice of every woman, and the voice of Dr.
Like a woman,
I'm very glad you think like that.
How you kept doing it? How in this 2024? How you keep doing it?
It's the way I see life, perhaps, because it's not. It's a question of mentality or what you imagine somebody will be called to see or to accept. Or to, imagine I would say, okay, this feature should be like that, and I will do only that. Nose number 2 for you, and for him, nose number 3. And no, I mean, everybody is different, and everybody will have also the content, the satisfaction of the surgery if it respects what he or she wants. If you impose your point of view, I think it's wrong, in my opinion.
Thank you. So, coming to the other part, we usually play a little bit. Well, who played with my Jenga? Who played with the Jenga? You played. You played with Jenga.
Sorry. What? At the phone call, I had the Jenga.
We need to play and we need to see your hands, okay? The surgeon hand.
Yeah.
Okay?
Very good.
Okay? The surgeon or the derma or surgeon hand. But you played with it too hard. There is missing part here.
It's not missing, it's on top of it. That's
Where
the
is
whole
it?
game. It's there. No, you pick it from here.
But you cannot, but you
and
cannot
here.
put 3. You have only to put 2.
Oh, you put whatever.
No.
I make the rules.
You make the rules. I am the consultant.
With my children, that's how you play. But fine.
But you take it from down, you put it up, but you can't put 3. You only put 2 up.
Okay, perfect.
So you are
put
trying
3 is better.
You put 3
It
up.
falls faster.
Faster?
Yeah.
Okay. Have you played or not?
Of course you did. Your turn.
Cheating. Cheaters, my Jenga. This is my turn. And voila. And if you didn't let me win, I don't know what I'll do, but I'll do something bad.
No.
Okay?
Nothing to do bad. Okay.
Play a turn if you want. خلاص? I played my turn.
خلاص.
ابتسام بتشوف الحياة حلوة ونحاول نستغلها في أشياء اللي تستاهل، ما نضيعوها على أشياء ما تستاهل وتضيع حياتنا كلها.
We'll come to this part, talking to the face and the double chin.
والله متوترة خايفة بس مبسوطة كثير إن راح تكون نتيجة، يعني عندي إحساس كبير إنه راح تكون نتيجة أكثر ما أنا متصورة.
اندولفت خيار حلو بدون جراحة بدون داون تايم.
استوديو نور الممزر.